Hello, all, and welcome to our Owl About Rice parent webinar focusing on student mental health resources. My name is David Humphrey, and I'm the Assistant Director of Parents and Families Programming here at Rice. Today, you will be hearing from representatives from two key offices on Rice's campus, the Student Wellbeing Office and the Rice Counseling Center. I'm pleased to introduce today's speakers. First, from the Student Wellbeing Office, we have Elisa Brewer. Elisa is an LPC associate who completed her master's in clinical mental health counseling at the University of St. Thomas in 2024. She's also a Rice University Brown College alumna, shout out to the Brownies, where she served as an undergraduate student intern for 2 years while earning bachelor's degrees in neuroscience and cognitive science. She was also the campus-wide coordinator of the Rice Health Advisors as an undergrad and became the lead research data coordinator for TCDD, a clinical research firm working on COVID-19 vaccine trials. In her current role, she enjoys supporting college students, especially Rice students, as they navigate the academic rigor and social challenges unique to university life. Thank you for being here, Lisa.
Thanks for having me.
Yes. We are also pleased to be joined today by Gabe Ramirez, LCSW, who joined Rice in 2019 and serves as the director of the Rice Counseling Center. He earned his bachelor's degree in psychology from the University of St. Thomas and his master's from the University of Houston Graduate College of Social Work. Before joining Rice, he worked in both residential and outpatient mental health settings, providing therapy for adolescents and adults with complex psychiatric and behavioral challenges. In connection with clinical therapy, Gabe has also enjoyed providing talks and workshops, helping people to understand anxiety, depression, addiction, and resiliency through a holistic, compassionate approach. Thank you for joining us as well, Gabe. Thank you both for being here, and thank you to our attendees in the audience today. We are excited to have you parents here to join in and be able to hear from these offices on campus. In addition to pre-submitted questions we received ahead of the event, you can send any questions that you may have today through the Q&A function. My colleague Emily is here to assist us with managing that function. We will do our best to get to your question after the presentation. If we do not get to a question today, feel free to email us at parents@rice.edu, and we will work to find an answer to your question. Without further ado, let's hear from our guest speakers.
All right, thank you so much for the introduction. I'm going to go ahead and share my screen so we can get started here. Okay, so allegedly you can see my screen, but welcome everyone. As introduced, my name is Elisa and with me is Gabe. So welcome. We'll talk a little bit about well-being and counseling at Rice. The intro given was really good, so there's not too much more to say about me, but I am an alum and I've worked at Rice for almost 4 years now. So it's really nice to be back on campus where, I do kind of understand what students are experiencing just because I've been through the same Rice experience, but of course each student is individual and their experience is individual as well, but it's lovely to be able to give back in that way. Gabe, was there anything else you wanted to mention about you?
No, I think that was a wonderful bio. So happy to be here as well. Looking forward to any questions you may have and hopefully just giving some more information that sounds like maybe a refresher or maybe sounds like kind of an update that you as parents might have and of course be able to share with your Rice student.
Great. So every 3 to 4 years, we do what's called the National Collegiate Health Assessment. And on our campus, we survey all of our students to see how they're doing in terms of their mental, physical health, sexual health, and all different aspects of health. And what we find in the NCHA are some common well-being concerns as well as the most common mental health conditions. So I wanted to share a little bit of that with you so we can understand a little bit of what Rice students experience. And so this is our most recent one from fall of 2024. So it's just about a year old. We also know that well-being concerns or mental health concerns are maybe different than mental health diagnoses or conditions. So these are our top 10 for what concerns students most about their well-being while they're here at Rice. We see procrastination with a 70% response rate to students who are concerned about procrastination. We see 54% of students who have thought about their academics as one of their well-being concerns, 47% who consider their personal appearance one of their well-being concerns. We also see a pretty high rate of career concerns at 38%, And we see health of someone close to me also up at that 28.5%. So we know that there are students who do experience mental health challenges or mental health diagnoses, but there's also these other factors that are affecting our students and their mental health and well-being. So we try to do our best between the two offices to also help them navigate all of these things that fall gently outside of a mental health diagnosis. These other things that we see, intimate relationships, family, finances, peers, and roommate or housemate, are also things that our students do find themselves being challenged with while they're here at Rice. And I think a lot of these would fall mainly under the Wellbeing Office, which will kind of delineate what falls under which office and how we help those students with these respective concerns. But this is what we see being some of the most common well-being concerns for students here at Rice. Then we also see some of our most common mental health conditions. So what we know is that these are all self-reported, so students voluntarily give us this information. And it is possible for a student to have maybe two conditions at the same time, or maybe have been diagnosed with a condition in their past. So they may have reported that they are diagnosed with this thing, but maybe they're not experiencing those symptoms anymore. So this is all self-reported data. We also know that the Rice data is similar to the nationwide collegiate data across the spectrum of other like and unlike institutions. So we do see that anxiety and depression are still the two highest the highest rates of mental health conditions that are affecting our college students. We also see almost 10% of our students who've been diagnosed with ADD or ADHD, attention deficit hyperactivity disorder. We see about 4.9% with obsessive compulsive disorder diagnoses and about 4.2% with eating disorder diagnoses. So one of the things I wanted to mention, just based on the last several years of data that we've collected, is that our anxiety and depression rates have remained fairly similar across the last 6 or 7 years from the data that we have. But we've seen a rise in ADHD diagnoses and a rise in eating disorder diagnoses, about almost a whole percentage point rise in eating disorder diagnoses from our 2021 data to our 2024 data. So we understand that there are more students on our campus now who are maybe struggling with a couple of these things. Let's see. Gabe, did you have any other thoughts on any of these mental health conditions?
Yeah, absolutely. These are things we might talk a little bit about later in the presentation because what's true of both of our offices is that we really want to provide education and support as students are exploring whether or not they might meet the criteria for some of these experiences. Oftentimes students, they might be experiencing symptoms prior to coming to Rice. They might be learning a little bit more about that as they're adjusting to Rice. And really just helping people to understand what some of these terms and symptoms might mean for them, and also letting them know that even though they might at times fit the criteria for one or more diagnosis, that oftentimes diagnoses are not permanent, or they might be able to learn some skills or increase their support to really kind of find a better sense of functioning. Um, Also, just where a lot of students are at this point in their life, might be where they're learning more about some of these diagnoses, and they might be learning a little bit more about how this might show up in terms of their adjustment. So pretty age appropriate that someone might start to just be exploring and questioning when some of these things might pertain to them or those around them.
Absolutely. And it's not uncommon, right, for students to experience some of these acute symptoms, maybe even for the first time or at a much higher level while they're here at Rice during that adjustment period, as Gabe mentioned. So when it comes to how we help students, a lot of times we rely on referrals. Either students will self-refer, meaning that they voluntarily come to our offices and say, um, this is what I'm experiencing and I'd love some help navigating this. Or we get referrals from the community as well. So one of the questions that we ask most is if, based on their fellow students' education, based on what professors or the staff members at the residential colleges might see, do we know somebody who's in need of mental health support? Do we know somebody who might need help? So we ask first and foremost, okay, I know somebody who might need help. Is this an emergency? And of course, if it's an emergency, we have two options. For physical or medical emergencies, there's the RUPD and RICE EMS phone number that we recommend if it's a physical or an unknown emergency. And there's also the Rice Counseling Center 24/7 line. So if it is a mental health crisis, that there is mental health support available at all time for students. So from 5 p.m. to 9 a.m., there's a service that we pay for called Protocol that students can call and access mental health experts while there may not be any folks present on campus or in the offices, that they are never left alone to handle those significant mental health challenges, even when it's late. And if you know college students, a lot of their crises do happen when it's late. So we make sure that they have someone to talk to at all times. And even if it's not a crisis, they can call and still get that amount of support. Um, and then Gabe, correct me if I'm wrong, but I believe you all get a report the following day, so y'all can reach back out, right?
Absolutely. Anytime a student calls protocol, whether it's for more of an urgent need or if they were maybe calling just because they wanted to schedule an appointment, we do get that forwarded to us each morning. That way we're able to reach out to a student as soon as we open and just make sure that they're getting the level of support that they need or follow up on a call. Protocol is staffed by licensed clinicians, so if a student is in need of support, they are able to talk to somebody who can help them through some basic skills coaching and assess for any kind of safety concerns. And then if it's appropriate, they can circle back with us in the morning and we can follow up to see if they want to come in for an in-person appointment or maybe they're getting connected to services off campus. But yes, we are notified by that every day. We also do have a counselor on call throughout the year. So if, for instance, a student calls protocol and it's just determined that they need to touch base with someone at Rice that night, we have somebody on call that they can speak to see about next steps. There also is, in the last few years, we also have a mental health provider that is housed in RUPD. So if a student maybe is experiencing a mental health crisis or a need of support, in the evening or weekend, there also sometimes can be an opportunity to meet with someone in person if they contact RUPD.
Absolutely. And then in the situation where a student maybe needs to talk to someone, but it's not an emergency and maybe it can wait overnight or they just need some extra support, they're welcome to call the Wellbeing Office in the Counseling Center, which we'll talk about our services in just a little bit. We often refer to the SAFE office as well for students who have experienced or are responding to allegations of interpersonal or sexual violence. And then Student Health Services, the physicians here on campus with the clinic on campus. And maybe the last resort being like, no, they may want to talk to someone, or maybe a student isn't quite ready, but they might need that extra level of support. We have a resource guide as well, which you all can also access. If you scan that QR code, it'll take you to our resource guide that are it's available electronically for all students, of course, and it's also stashed all over campus. We have probably 3 or 4 dozen little containers where we make sure that there are resource guides available to students at all times. So we can talk just a little bit more about exactly what our offices do. So with the Student Wellbeing Office, our I guess our 3 main roles are well-being advising and case management, and then our education and outreach programs. So in our advising and case management, we do offer individualized support for students who are handling what I like to call the day-to-day mental health concerns, where they may be under a great deal of stress. Perhaps something unusual has happened, like a breakup or a difficult conversation, a tough situation, maybe in their living space, but um, they're still able to interact fairly well. They're still able to function well. We primarily deal with executive functioning situations or cases. So we do offer that individualized support. There's some issues that we can help with that are listed there: the academic stress, procrastination, decision making, and other stressors. And then through that well-being advising, we also offer those students, real-time skills that they can start to implement, or we may even be able to hear about their stress, look at their schedule, and realize their schedule is built so that they experience more stress, so we can help them plan that out better. We also offer guidance and coordination on a care plan for personal challenge or crisis. So if a student is experiencing an unusual crisis, part of our case management role is to make sure that that student is not just given resources, but actually connected to them. So we kind of hold that student's hand and make sure that they're getting connected to the people who can genuinely help them across campus and across the different disciplines, which, may be affecting that student's ability to function well in the academic environment. So yes, we do help them navigate resources, and a lot of times that may be us sending that referral or receiving a referral, helping a student understand what the next steps might be to get their question answered. And then the other half of what we do are the educational programs. So this is my primary role. I am the Assistant Director of Programs and Education. So a lot of what I do is bringing the mental health information and special topics out into the community. So we have mental health and wellbeing education. We have a substance use and recovery specialist. We offer student group advising, which I'll talk about in just a little bit. And we also offer workshops for things that we give every single semester with some regularity on a calendar. And then we also give opportunities for tailored requests, collaboration with other offices, overlap of special topics and special interests for different student groups or organizations. And we do somewhere between 150 and 200 programs per semester. So we are out in the community as often as we can be, trying to make sure that students are not only connected to resources, but also understand some basic mental health support information for themselves that they can use to sustain their productivity and well-being over time. And then Gabe can tell you a little bit more about counseling.
Yeah, thank you so much. So you might have heard from your Rice student already that maybe they've worked with the Wellbeing Office, or they might say, I think it was the counseling center. It happens often. We work in the same building, we work in the same hallway, so sometimes there can feel like a little bit of an overlap. But we're always available to talk to students about who might be the best fit for them at that moment and remind them what our services are. So as David mentioned, I've been with Rice since 2019, and since that time, our office has certainly grown, not just in terms of staff, but also in terms of services. Our staff at the current moment has 17 clinicians on staff. We're comprised of clinical social workers, licensed counselors, psychologists. We also have 2 part-time psychiatrists on staff that are available to meet with students who are assigned to a counselor. We also have 2 graduate level interns that see students. What we are here to do, oftentimes we know that we are a student's first contact with a mental health professional. So I know that me and my colleagues, we take a lot of pride in making sure that that first point of contact is an experience that is helpfully informative, letting them know if people have some questions about their mental health or some things they might have been contemplating for a while, and also supportive, whether that's getting connected to us for ongoing services or maybe referring them off campus, just making sure that we are providing an experience that is conducive to a student reaching out for what they need. Um, as I mentioned before, we do have a pretty large staff at the moment, and we're always growing and expanding. Currently, most of our services are offered Monday through Friday, 9 to 5, although we do offer now evening and weekend appointment times. We also provide in-person and virtual appointments. So if students just kind of find that fits better for their schedule or for their time management, we're happy to meet them where they're at. One thing that I always like to remind folks about is that our services are included in student service fees, health fees. So whether they want to come in for an assessment or a session or a consultation, that's something that's already included in their student health fees. Another reminder that I think it's important for both students and parents to remember is that we are a confidential office. So that means that everything a student talks to us about is a private conversation. And if they would like to have more people involved in their treatment, whether that's parents, family, the Wellbeing Office, they are required to sign a release. It does happen at the beginning of each semester. We do have some students that are under 18, and so we are still able to meet with them for an assessment, but we do need parental consent for that. Typically happens a little bit more at the start of the semester, but just a reminder for anybody that maybe still is under 18. A little bit more about what some of our services might look like. As I mentioned before, we often will see students that maybe they've worked with a counselor before, maybe they've had a pre-existing mental health diagnosis, but most commonly we meet with students where this is their first time talking to a mental health professional. It's pretty common for students to say that maybe they've struggled with anxiety or depression or other issues during high school, but maybe there just was either barriers or just they didn't feel quite ready to talk to a counselor. So they can call our office, they can come in and schedule an appointment. And one of the first things we want to do is schedule an initial assessment where that way a student just has an opportunity to talk to a counselor about what their experience is in terms of mood, social life, sleeping, eating, academics. We really just try to get a comprehensive view of some of the experiences a student's having, and based off that assessment, we might recommend that they get started with us for counseling. We operate from a brief solution-focused therapy model, which means that we are very goal-driven. We want people to know what progress can look like for them. And so we work with them to set some goals about what feels like progress and also self-learning. We do meet with students on a bi-weekly basis, so we will schedule an appointment with them every 2 weeks for as long as they feel like that might be helpful. At this time, we don't have any session limits, so oftentimes students might be worried and say, "Oh, I can only meet with them 3 or 4 times." And if that's ever a barrier, I encourage them to come in and talk to us about what feels helpful for them. Um, we also work really closely with the Wellbeing Office. So let's say there's a student that comes in and really would benefit from just having a contact on campus. They may meet with myself or a colleague for counseling, and then they also can meet with the Wellbeing Office in between sessions and just feel like they have a really comprehensive support system on campus. We work with everything from students to learn about anxiety, depression, grief, and loss. We promote a lot of education around mental health to people to understand and normalize what they might be experiencing, which, as we talked about, might include some of the diagnosis that people identify with, but also what might be a part of their adjustment process for students who are moving from a different country, a different state, a different city, who, living on their own for the first time. There's a lot of things that could be experiencing with their mood and the behaviors that could be just reflective of where they're at this point in their life. Um, Not every student that comes in for an assessment may want to work with us. They may have a very specific idea in mind about who a counselor they may want to work with or a specific topic. And so sometimes we help them to get referred off campus. We have 2 care coordinators on our staff who are able to meet with students to look at their insurance, to look at their benefits, and provide them an updated list of providers in the Houston area or maybe back home, which we'll talk a little bit about when students are going back home for holidays or a break. But the care coordinators can help students just to learn a little bit more about what services off campus looks like, whether that's for therapy, for ADHD assessment, or learning more about neurodivergence. There's a lot of things that here in Houston that provide, and we just want to give them more education. And we also, as Elisa mentioned, we can help with a little bit of hand holding. So if a student reaches out to a provider that has some questions afterwards or is struggling with some ambivalence or some reservations, we can help them to answer some questions about what that might look like. Just a reminder as well, as we mentioned, we do have a 24-hour phone line. So if a student ever feels like they need to reach out to us for support, we have protocol on staff, and then we also have an on-call therapist. We also have walk-in availability throughout the day. So if a student just feels like that's the exact time when they feel like they're ready or they want to touch base, or maybe they're experiencing a higher level of distress or a mental health emergency, we have people on staff throughout the day where they can come in and meet with a student. I think we're one of the rare counseling offices on a college campus that we don't have wait times or a wait list. So oftentimes if a student reaches out to meet with a provider, it's a very quick turnaround to where they are first point of contact and then scheduling an appointment with us. Um, we are also available if there is a mental health crisis on campus. So as we mentioned before, always important to know our number. It's on their IDs as well, but they can call us or RUPD and we can provide some, immediate assistance if we need to learn about some coping skills for in the moment, or if we also need to help some students find some emergency services off campus.
Perfect. So we will go just into a little bit more about our respective offices. So this is our team at the Student Wellbeing Office. You can see there are 9 of us. So Agnes, our director, we have Curtis, Henry, and Chris Nunez, who are the directors of case management. Then we have our wonderful wellbeing advisors, Angie and Sydney, who fall under case management. And then there's me, of course, for myself, and then Gudine and Erin work with me as programming specialists. Gudine is our graduate wellbeing advisor, though she does meet with undergraduates as well. And Erin Timmerberg is our wellbeing advisor, who's also our recovery specialist. So she works a lot with students who may need a little bit of extra support on the substance use and recovery side of things. There isn't it, Rice is a wet campus, so there are sometimes incidences with alcohol. And Erin works with the Rice Counseling Center for those students who may need a little bit of extra support, specifically around their substance use. And then that very friendly looking gentleman up there in the corner, Henry Cash, he is much friendlier in person than he looks in that picture. But he won't let me take a picture when he's smiling. But Henry Cash works a lot with our student athletes as well as students who may have some behavioral concerns along with their mental health concerns. So he works a lot with different kinds of students, but especially after incidences where there's behavior consequences involved. He works a lot with them. So Agnes, Curtis, Chris, Sydney, and Angie are primarily our case management team. Myself and Karine and Erin are primarily our programming and outreach team. So I wanted to touch just kind of briefly on what kinds of programs and workshops that we do. So a lot like this presentation that we have for all of you, we do a lot of programming, especially around orientation. So every time, every August when our first year students come to Rice, we give them a couple different orientation sessions. We train the orientation week or O-week advisors in what we're going to be talking about. Then we talk to each first year student um, sometime during a week with a lot of this same information, as well as some other tips and things to look out for within their first year. But then throughout the year, we do things like time management presentations, stress management. We talk about uncertainty, which is particularly popular with our juniors and seniors making plans for the following couple of years after they graduate. We do several suicide prevention trainings per semester. We try to do at least one every month, if not two or three. Especially in September, we have a lot of suicide prevention trainings because that is Suicide Prevention Month. We also offer meditation sessions and other types of sessions that we do just out in the community throughout the semester. We also teach mental health first aid so that anybody who wants to be certified on the Rice campus is able to experience that training. It's a really long training, so we only offer it a couple times a year. But we do have several people on campus who are trained in mental health first aid. And so some of our workshops are purely for information and learning. Some are a little bit of learning, a little bit of social engagement and fun. And then we also host general low stress, low involvement sessions where students can just come, hang out, take a break, have some rest, and also have several well-being advisors there if they want to talk about what they're going through, to try to decrease or kind of take down some of that barrier of managing or accessing care, to just offer them a softer place to come in rather than having to make an appointment to see a mental health professional. And then along with our programs and workshops, we also oversee several peer support organizations through the Student Wellbeing Office. So each of these organizations is staffed mainly by students, but overseen by the Student Wellbeing Office so that we offer them guidance, funding, information, and leadership opportunities, really. So our caregiving program is one of our longest standing programs, and it's students who volunteer to be sober at publicly registered events like parties both on and off campus that are hosted by Rice students or Rice organizations. And the caregivers are trained in how to support those who may become overly intoxicated at these parties, as well as to issue harm reduction information and help students stay safe as they're engaging in those activities. The Rice Health Advisors is a program that is near and dear to my heart. I teach the course. It's a 3 credit hour course that students will apply to. They go through an application process to be selected as a Rice Health Advisor for their individual college. So they take a 3 credit hour semester long course in all things mental health and well-being. So we touch on lots of different topics and how not only the RHAs can help themselves, but how they can also support their peers as they're going through their Rice experiences. So it gives a really solid group of students a good basis to be able to serve as peer liaisons between their residential colleges and the Student Wellbeing Office to kind of try to bridge that gap as well and normalize some of the conversation around mental health. That organization has, I think, about 120 members right now scattered across the 11 colleges. So it is a pretty large and strong program. One of our more recent initiatives is the Owls in Recovery. So, Erin, like I mentioned, is our substance use and recovery expert. She oversees the Owls in Recovery, which is a weekly support group for those who are in recovery, especially from substance use disorder or substance use concerns. But anyone in recovery from mental health is also welcome to join in those meetings, and those happen every Tuesday from 5 to 7. The other organization that we oversee closely is the Rice Alliance for Mental Health Awareness, or RAMHA, and they do wonderful information sessions where a lot of times they have great snacks, and sometimes will even convince the psychology professors to give students credit for coming out to their events where they bring in guest speakers from off campus. They talk about different mental health concerns or special topics. Maybe they will host a yoga or meditation session. And they'll also have some deeper conversations. Very often they'll do panels about different experiences in the realm of mental health, whether it's, navigating mental health as a senior in college, how mental health professionals chose their jobs, or different kinds of things like that. And then the last one is the Rice Women's Resource Center, which we co-organize with the SAFE office here on campus. It's a center located here on campus in the Rice Memorial Center, or the Student Center. And it's not only for women, but it has a lot of resources for students who are interested in maybe learning about reproductive rights or need other reproductive health care or sexual health care. So it has supplies for students who might need them, as well as information, and is also just a soft place to land in case they need to talk to someone at a peer level. And then Gabe can talk a little bit more about his team as well.
I know we have some topics we're going to chat about in a moment, so I won't go through my team one by one because we are quite large. But as you can see, we have a pretty big team, a pretty diverse team. So I know that when I'm doing an assessment with a student, I have a lot of confidence in asking them if there's something that they would feel really comfortable working with someone, whether that's gender, background, approach, that I have someone on my team that can meet a student's needs. Um, we have a very high retention rate on terms of our staff. So we have some folks here who have been here for over 30 years. We've had some folks that have been former interns. So I think that we have a team that really allows us the ability to touch base with where students at and give them some perspective around rights, while also, as Elisa mentioned earlier, being able to learn a little bit more about their experience and what that's been like adjusting to Rice. As you see there at the top, I actually did step into the director role as of October, so we are going through very much of a transition and exploring where our services are going to continue to grow. I myself am very outreach focused, so I enjoy being able to go out on campus and talk to students and families about mental health and providing information around services and resources. And I know that I have a lot of people on our staff that really enjoy being able to go and touch base with different colleges, different student groups, and really being able to just talk a little about and normalize some of the things people might be experiencing along with their mental health. As I mentioned, we do have two part-time psychiatrists on staff. A student does have to be working with an RCC counselor in order to meet with a psychiatrist, and they do have to go through an assessment and get scheduled for an initial individual session. So oftentimes as well, people might have questions. Our psychiatrists do not provide any ADHD prescriptions. So if a student is wanting to get more information or prescriptions around that, that is something that we would refer them off campus for.
So I'm actually going to skip ahead rather than going back to our contact page, but I just wanted to also mention kind of some of how we help and what we notice as the clinicians on campus. So we know that some of the busiest times are orientation, when new students are really going through that transition of adapting to college life, sleeping in a new space, eating in a new space, going to classes, and managing all of their time by themselves. It's really different, right, from high school, where there's a lot of things that are determined for them. So orientation and that first month of school is typically a busy time for us. We see it pick up also in September, October, or February, March, around that first midterm season. And that's true for first year students as well as well-established upperclassmen. Midterms are just a stressful time. And then a lot of times we also see a big pickup right around finals when students are maybe getting more concerned. They're making decisions about whether or not to drop classes, especially for our first year students who can drop all the way until the last day of class. And we also know that finals is a tough time. And then I think in the Q&A, there was also a question about what I mentioned about juniors and seniors looking forward to the next few years. And application season is a great way for me to highlight that as well. When our students are in or getting close to other times of transition into new life stages, whether that's their first summer internship, applying to medical school or graduate school, or trying to get jobs, any sort of application season or looking ahead does create a lot of stress, a lot of uncertainty, and it is simply challenging to be out there applying for a bunch of different opportunities, not knowing which one you'll get and having all of that paperwork to do. So we also see some busy times around application season or when answers about medical school and grad school come out, especially for our juniors and seniors. We also offer those academic stress tips. I talk to students with great regularity about planning being the best way to prevent academic stress from building, or learning themselves and how they work best can prevent a lot of hardship in the future. We also talk about setting boundaries, both time and interpersonally, having students be able to set times that they will or will not take on extra tasks, when they're working best, when they're most efficient, if they're morning people or evening people. And we work a lot with them on just learning how to prioritize and how to build in some task initiation for themselves as they go through different challenges throughout their experience at Rice. And that's not, again, not just for first year students. These are things that we visit and revisit. And there are some students who I've seen for their almost 4 years at Rice, and we're still talking about those things from time to time because as their situation or lifestyle
Mhm.
changes, these things might need to be readjusted as well. Um, and then as far as adjustments, we just see a lot of them. Um, the social scene, fitting in, learning a new campus culture, learning all the funny words that Rice culture has to offer, as well as, friends or romantic breakups, trying to find the right groups and organizations for them to be a part of where they can build that sense of community and belonging while also experiencing excellent opportunities that only a place like Rice could offer. Um, there are a million leadership opportunities for students to have, and we do see that students tend to overcommit a little bit. So we also talk to them about discerning leadership opportunities, how to make sure that they are taking advantage of what's available without also burning themselves out too quickly. We talk a lot about balancing schoolwork with extracurriculars, or even just the chores of being a person, and being an adult, kind of living in your own space, especially when students move off campus for the first time. And then also just the super basics of eating and sleeping in a new place. And when students have trouble adjusting to that, we can usually have some conversations with them, whether it's how to bring a little bit of home back to campus, or how to manage those adjustments as it's increasing their stress level. Gabe, did you have any thoughts on any of this?
Yeah, just a couple of quick add-ons. I mean, I definitely think looking at the that timeline there of busy times, I mean, that might be where you have noticed a little bit more or less contact with your Rice student, depending on if they're having to study more, if they're having to engage more on some of the responsibilities. And right, I think really normalizing what that adjustment can look like, because as we mentioned, like adjusting to coming to Rice for the first time, but also sometimes even normalizing, adjusting to each semester and changes. And also not just changes that are happening at Rice, but remember, as we all know, adjustments that maybe are happening back home. Or as we talked about in a previous slide, if there are things like a family member going through an illness or stress at home, there are things that people are adjusting to as well as their support system is adjusting to while trying to manage all their responsibilities and manage oftentimes forming new kind of layers of their identity here at Rice. And so, again, these are just things that we certainly meet with students about and try to normalize that what they're experiencing is not abnormal. In fact, even just recognizing some of these dilemmas and stress is actually a sign of a very healthy system to notice, like, hey, something feels a little bit off or something isn't quite following into pattern as quickly as I thought it might.
Mhm. And then so in our last couple of slides, we wanted to give you all and kind of refer you to our resources page because we do have some resources here for families. We have some resources for your students, and this is a publicly available. The information for families is publicly available as well as our community resources. So if you wanted to scan this QR code, you should be able to see that page. And then for students, we also have some extra resources where we have printouts, handouts, as well as contact information for our offices so that they can also schedule with us online. And then Gabe was also going to talk about how you all as parents and supporters can help as well.
Yeah, absolutely. So, I was there during a week and during Families Week, so I know that for some folks, the conversation around support and mental health might be a conversation you've been having with your student for a while, and for some folks, that might be kind of a newer experience in conversation for people just starting to kind of go into some of those topics. So, whether that's you being a source of support and your student being able to talk to you about some of their things, or adding on to their support system. I always talk to students, like if they come to meet with me and they do sessions with me, my goal is not to replace their friend group or not to replace their support system, but just be an addition to it. And one of the things that can be really helpful for students when they're feeling overwhelmed or feeling uncertain is to give them kind of an office or a name to say, have you touched base with this office? And so as we've talked about our offices today, the Wellbeing Office and the Counseling Office, we also work closely with the SAFE office on campus, as Elise mentioned. That can be a safe space for people that may have experienced interpersonal violence, but also it can be a great resource for learning around boundaries in relationship, learning about healthy relationship dynamics. And so they can meet with someone from the SAFE office just to, help them to have some resources around boundaries and relationships. There's also the Career Development Center. The Student Disability Resource Center also just hired a new director. So they're also going through a season of growth and transition about really trying to meet students where they're at. And of course, the Center for Academic and Professional Communications. Just a reminder, the RCC is a confidential office. So if a student is wanting us to collaborate with those offices, they would have to sign a release. We also want to spend a little bit of time looking ahead. I know right now, if you were to ask your student about winter break or the holidays, they may say like, this is not the best time during midterms. But, looking at what would it look like for them to come back home, and some things you can kind of keep an eye on, or some things you may be able to just normalize with them and practice some curiosity around. So as you may know, your student, they're working hard, they're managing a lot of different responsibilities. Then when they show up for Thanksgiving or winter break, they might feel a little worn out. They might just be wanting to reset and kind of take some things off their plate. It's also important to look to see if that is also a little bit more burnout. So you might be noticing students just feel a little bit more disconnected from some of the things that previously brought them joy. They might talk a little bit more about anxiety about the upcoming semester and resuming courses and social responsibilities. And so they might not really, they might be sleeping more, they might be reporting a little bit more physical symptoms. You might just notice a change in their sleeping habits, their eating habits. So these are things that we can start to just, of course, support them around right now by encouraging them to practice their ADLs, encourage them to try to be consistent with their sleeping schedules, prioritizing self-care along with academic responsibilities. And as we've talked about today, reminding them that they can touch base with the RCC, the Wellbeing Office, or other offices on campus. One thing that we do have common conversations around with students is what it's like adjusting being back home. As Elisa mentioned, they've been here managing their own schedule and responsibilities, and then going back home for the holidays. They might be expected to pick up around the house or to drive younger siblings around or have a curfew. And so those are things that we can start to practice curiosity around to see what people's expectations would be for coming home. It's also not uncommon for Rice students to struggle with downtime. So there might be people that really want to schedule a lot of their breaks with a job or research. And while that can be really productive, it also is important to really promote balance about doing some things that provide some self-care, that promote rest, and having some structure during their break, but also making sure that they are actually having a break and getting ready for next semester. So
Yeah, thank you so much. And then so kind of to help us wrap up, we just always want to touch on the culture of care that we have here at Rice. You all have cared for and raised beautiful, brilliant children who have become these beautiful, brilliant adults. and y'all have cared for them their whole lives. And so we appreciate the opportunity to be able to share in similar care in a little family here at Rice and practice that culture of care through, our vocations, as well as seeing your students care for one another and helping them take better care of themselves and each other. So I know the culture of care was really important to me as a student and just as important to me now as an employee, and a staff member. And so we appreciate the opportunity to be that, for your students as well. So I'm happy to go into Q&A as well. I'll just leave on this little ending slide so you do still have our contact information. Looks like we have some good questions.
Yes, thank you, Elisa and Gabe, for sharing that information. We'll jump into this Q&A. We'll do our best to get to as many of these questions as we can in the time remaining. If there's a question we don't get to, I do also encourage you parents to reach out to us at parents@rice.edu, and I'll make sure that that question gets to the right place. But to start, Elisa, you had mentioned that there's training and information shared with students during O Week surrounding mental health challenges. So just wanted to see if you can elaborate on how students are introduced to that information about mental health challenges, so that they are able to identify and know when they might need help from the services of y'all's offices.
Absolutely. So during orientation, it is, like I mentioned, a presentation that's very similar to this one, but we or we provide information much more specific, including the warning signs of an incoming mental health challenge that covers a wide variety of warning signs. We don't necessarily say, here's the diagnosis, here's the symptoms, but we give kind of that overview of here's what you'll see if your mental health is starting to falter and how you can know when it's a good time to talk to somebody. So we do that during orientation. We talk a little bit about suicide prevention as well as part of the state mandated information that we have to give students for suicide prevention. So we give some warning signs of that as well. And then we also include how students can navigate the systems and how to reach out to us. I always, in every presentation that I do, I give the rule of thumb that if something is bothering you and staying on your mind for more than 2 or 3 days, you need to talk to somebody, whether that is a parent, a professional, a staff member, someone at the residential college, a best friend, a coach, a mentor, but somebody, because any longer than that, and students can really start to bottle all of those things up. So I always let students know that if it's bothering you, go ahead and talk about it because that's what we're here for. And then if students choose to come to any of our events during the semester as well, a lot of times we are talking about some symptomology or some common stressors. The Rice Health Advisors also have campaigns in their different residential colleges and sometimes across campus about what common mental health conditions look like or what feelings are within what we might call like normal functional range versus when it's worth talking to someone about. But we do try to keep it at the forefront of students' minds, even though we understand that there's a lot of concerns that they have and that they're extremely busy. So there's no single class, but there are a couple of orientation modules that we offer them.
All right, great. Thank you. We got another good question, particularly around students with ongoing conditions such as AD&D or anxiety. So can either of you share strategies that y'all use or your office uses to ensure ongoing monitoring and support for students with conditions like AD&D or anxiety, particularly when a student needs consistent support for their academic and personal success?
Yeah. What strikes me? I mean, I think in terms of like how my office will help a student who's experiencing anxiety and ADHD, again, like one of the first steps is really about education. So meeting a student where they're at about how they're understanding their symptoms or how it's showing up in their day-to-day life. If a student is working with a counselor and they're experiencing heightened or moderate anxiety, we can go through coping skills to help them to better understand and notice when their anxiety is a little bit more forward and things that help them to feel a little bit more regulating of their anxiety, their thoughts, their behaviors. As I mentioned before, along with like skill teaching, if someone feels like they also might benefit from an assessment for medication to see if that could be supportive. If they are working with a counselor, they can do an assessment with a psychiatrist, or we also can help them to find some services off campus. Sometimes a student, if they're looking for medication, but maybe quite not sure about counseling, we might refer them to their primary care physician to see if that might be a route to explore first. With regards to ADHD, it is pretty common that students will come in and they maybe have considered maybe being having a diagnosis of ADHD, but it's not something they've been formally tested for. So we help them to find some services off campus where they can do some comprehensive testing to see if that's just a part of their story and learn a little bit more strategies around, how to manage that. Again, going back to where they might work with the Wellbeing Office as well, is to have more focused meetings around time management, prioritization, things that help them to really kind of tap into their strengths around organization. And then they might work with the counseling center just to, process new diagnosis or process, how that, adjustment is going for them and how they're managing perfectionism, imposter stress, things like that.
All right, thank you. We received a follow-up question to the question about the education resources offered at O Week. So Lisa or Gabe, can you all elaborate just once again on additional ways that that information is reshared with students throughout their life cycle at Rice, beyond just the onset?
Definitely. So there are actually a couple of new initiatives that we've started this year to also try to address that gap a little bit. It is physically and emotionally impossible to get 4,500 undergrads to come to an orientation every semester. However, we can send messages to everybody as much as we want. So we actually started a well-being newsletter this semester where we've added all of the students who are willing to sign up voluntarily, as well as all of the incoming class, because we have those lists and we were able to add everyone on. So we send a monthly newsletter as well as monthly information about what well-being, counseling, and other mental health focused events are going on. The Rice Health Advisors as an organization are supposed to also keep students aware of what's going on with our office, as well as keeping mental health topics at the forefront of conversation within their residential colleges. So we do hope that by their various emails, their group me's, their text chains, and other items that they are talking about mental health and promoting not only like self-care and well-being tips, but also those events and that information. And then I want to make sure that I actually answer the whole question. There's a couple questions coming in, online tutorials that are mandated and to push them. There are some around alcohol and other substance use that again happen around orientation and stay available to them throughout all 4 years. And we do remind them that those things are available for them to continue using, especially through our e-checkup to go modules that are mandatory for incoming students. And once they've completed them, we do remind them that they're available to those students again.
Yeah.
All right.
I would also, I would also say just a little, just with the counseling side of things. We, as I mentioned before, we definitely do have an emphasis on like outreach. And so whether that's start of the semester, middle of the semester, making sure that students are aware of what our services are and how they might differentiate from the Wellbeing Office. I will say though, like when it comes to counseling, there can definitely be some vulnerability in making that appointment. So oftentimes I will meet with students when they say, well, my magister or my RA or my friend mentioned they've worked with y'all and that was really helpful. Or a student says, oh, I was talking to my parent the other day and they recommended maybe that I come and talk to somebody. So, it's not just about giving the information or reminding them. It's also sometimes finding ways to reach a student that gives them, as I say, like gives them permission to kind of come in and explore, if there's any kind of like hesitancy with that. So again, I also really encourage their support system to normalize and just, follow up with us around that.
All right. We have time for a couple more questions. We have gotten a few questions surrounding drinking and substance use. As we know, those can each be areas of concern at college campuses. So can you all share a little bit more information about the Substance Use Task Force, Owls in Recovery Group, and other resources available to students to ensure their health and safety around these areas of concern?
Absolutely. So I see one question about the Owls in Recovery, if it's an anonymous group. It is for all intents and purposes, it is an anonymous group. So students are welcome to go and they follow what would be probably similar to like a 12-step rule. It's not a 12-step program, but it would be a similar rule where confidentiality is fully and entirely respected. And we don't keep records of who comes. So if a student wants to come, they're welcome to do that. And Erin will lead the group. She doesn't keep a record. She only keeps numbers. So we're not able to identify those students necessarily. I also saw some commentary on the concern around alcohol culture, which I think is super understandable. For the one concerned about beer bike and drinking alcohol and then going and getting on a bike, that hasn't been the case, I don't think, since the 80s, maybe the 70s, but somewhere along the line that rule changed. But there is an emphasis, right, in some of Rice culture on alcohol use. So a couple of things that have come up in the past few years are the Substance Use Task Force, as well as the Alcohol Policy Advisory Committee that reconvened after an incident on campus that made significant headlines and also really impacted our campus community. So APAC came out with 65 recommendations on what to implement across campus to improve adherence to alcohol policy, minor adjustments to alcohol policy, and how organizations here on campus could better support students around harm reduction information, recovery support, safe drinking practices if students are going to choose to drink, and different opportunities for students to engage in learning about why we have the policies that we have. So what the Student Wellbeing Office has done is, hired Erin. She is part of our response to the APAC recommendations. They recommended that we hire a substance use professional and recovery specialist. So we have done that. Those organizations have started / revamped. So Owls in Recovery being a new initiative in the last 2 years, Substance Use Task Force being a group of students who's interested in advocating for a strong alcohol policy that also respects the information or the opinions of students. And we do information during orientation and throughout the semester. We do things like recovery ally training, as well as harm reduction presentations around alcohol culture. That recovery ally training is a really special one because we worked with the Cougars in Recovery to develop this training, so that anyone in the Rice community could be an ally to somebody who's maybe in recovery, who's sober curious, who's in a space where maybe a friend of theirs is not super comfortable with alcohol use or substance use in general, so they can be a better friend to that individual. Anytime that we give these, we also give that notice, right? That one, alcohol or other substance use is totally optional and is absolutely not required to have a good time. It's totally optional and not required to fit in at Rice. And we also like to remind students that in a survey of all students, about 60% of Rice students drink or have ever consumed alcohol, which means 40% don't drink regularly / have never consumed alcohol. And then when you look at regular drinkers, it's actually only about 40% of students who are regular drinkers and about 60% who don't drink on the regular. So while it may seem like a majority of campus consumes a lot of alcohol, it's actually the minority of students here on campus who are active alcohol users. So we have tried to provide a stronger influence through alcohol education on campus. And we are always available for students, especially if their friend groups start to change or they're concerned about a friend's use, how they can also stay emotionally and physically safer when navigating choices around substance use, or even the people that they may be in and around, or if they're having problems with alcohol culture within their living spaces or their residential colleges.
All right. Well, thank you both for your participation in today's webinar. Very grateful to both of you for your services in support of the Rice community and all that you do for our students. Thank you also so much to our attendees for sending in some great questions. I'm sorry that we didn't get to all of them, but again, I definitely encourage you, if you have that specific question, send it on to us at parents@rice.edu. Elisa or Gabe, is there a way that y'all would like to plug ways that they can reach out to your office?
Yeah,
Yeah,
absolutely. I mean, as
they're
we mentioned,
okay.
sorry, our number is on the student ID. So we're housed in the same office, the same hallway. So we have a front desk staff that can assist any student in learning if they want to schedule with the wellbeing office or the counseling office or both. And if a parent ever has a question, they can reach out to us as well.
All right, excellent. Well, thank you all again for participating. Thank you to the parents in the room. If you enjoyed this, or if you have an idea or suggestion for a future webinar, we would love to hear from you. There will be an event survey sent out tomorrow to all attendees, sent to the email that you used to register for today. We also encourage you to save the date for our next webinar, which will be held with the Center for Career Development on Wednesday, January 14th, 2026. As a reminder, this recording will be made available on our parents.rice.edu website in the near future. And if you have any further questions, you can email our office at parents@rice.edu. Have a great rest of your day and go Owls.